All right. Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. I want to thank you for being here live on camera. It's April 29th, 9:02, and we're going to get started here. As we always do, I just want to remind everybody why we do what we do. We are here to improve the lives of our community with affordable health care. Thank you for being a part of that mission, and thank you for keeping that fire burning inside you. It's what we do every day. I saw some incredible pictures from events that were happening over the weekend. Thank you, special thank you to Chan for working over the weekend and supplying our agents with everything they needed for the events. Thank you to Angela for supporting and finding and coordinating these events. I saw Bud was out there. I saw Jimmy was out there. So great job, guys. I really appreciate you guys going above and beyond for the weekend. And, I have no doubt that you picked up some leads and you're ready to rock for this week. So we're going to talk a little bit more about that. So as we normally do, we're going to jump into the training calendar first. So I'm going to share my screen here and we'll get rolling. So first things first, as we normally do, we've got to keep one foot in the classroom and the other one in the field. And before I go through the calendar, I just want to say another special thank you to all those folks that came out to our advisor meeting last week. It was a phenomenal event, probably one of our best turnouts, and just very proud of those folks that made it a point to come out and learn about the new CMS regulations and get some new info. So these meetings are put together for you, and I know you can't make every one of them. I get it, but it's really really important that you make an effort to get out there because the team puts together a tremendous amount of effort to put these events on and get you the education that you need. So with that, this morning we've got some trainings happening at 10 o'clock. Humana is doing a veteran healthcare training. So if you're working with vets or looking to work with vets, that's going to be a good one at 10 o'clock this morning. Later this afternoon, United Healthcare is going through their veteran and TRICARE training. So it's a vet day today. We're also looking tomorrow. Aetna's doing a veteran training. So lots and lots of veteran trainings happening. This is really great because as we go through lock-in, these are the folks that need your help the most sometimes. So you got 3 different veteran trainings available between now and tomorrow. Also, tomorrow you've got All About Jarvis, which is United Healthcare's portal system. If you want to learn how to navigate that, Humana, there's a spelling mistake there, but we're all human. Humana's doing a dual eligible plan and resource training at 10 o'clock tomorrow as well. And then if you're new to United at 12 o'clock tomorrow, why UHC? Why should you be selling UHC? No mystery there. They're number 1 in the country. So should be pretty easy to figure that one out. Tomorrow is the last day of the month. So as a reminder, make sure that you get all your leads buttoned up, all of your clients taken care of, and no scope of appointment necessary for the 48-hour rule for the last 2 days of the month. So at this point right now, if somebody calls you and says, hey, I need to see you, you can see them and get them enrolled for May 1st without having to wait that 48 hours. So just a reminder on that. Moving over to May 1st, can you believe it? It's May 1st already on Wednesday. We've got our very own Al Clancy available for you at 9:30 every Wednesday. He is begging people to come onto this call. And like I explained last week at the monthly advisor meeting, Al is your virtual coach. He's the guy that's going to help you get to the next level. If you get stuck, lost, confused, or don't really know what to do, Al is your guy. So please make it a point to at least introduce yourself and connect with Al on Wednesday at 9:30. Also, Cigna's doing their DSNP training at 10 o'clock that day. They're doing a virtual office hours session at 11, and then United Healthcare at 11. Also, you've got lots of options here at 11 on Wednesday. UHC, finding and engaging consumers. It's what it's all about, guys. How do you get traffic? How do you get leads? We're going to talk more about that today. But UHC is great at talking about that, and they're doing that on Wednesday at 11. And then also, if you're having any contract questions or concerns, or you just want to get with the contracting team, 11 o'clock every Wednesday, Jessica and Sam have open door office hours. You can jump on virtually and they'll take good care of you and answer any questions that you might have. Thursday the 2nd, Aetna Medicare 101. Those of you that are coming in new, this is a great training for Aetna. United Healthcare is doing a grassroots training at 12 o'clock. Those agents that are doing grassroots training are crushing it right now. And we're going to talk more about that. But specifically, if you're not doing grassroots marketing, you're missing tons and tons of opportunity to grow your book of business. That's 12 o'clock on the 2nd. And then and then our training every Thursday at 3 o'clock. We've rolled out HQ, which is your brand new agent portal system. We are doing an internal training there at 3 o'clock. You guys can come on in, and we'll show you around. So that's being hosted by Al Clancy himself at 3 o'clock on Thursdays. And then last but not least, Tom Ryan's hosting our What About HPM Shop. This is our quote and enroll tool for Medicare, Medicare Advantage, supplements, and prescription drug plans. Also, some ancillary products are being added to this. So the more you know, the more you grow. And that is on the 3rd of May on Friday, 9:30 every Friday. So please make it a point to know these systems. It's very, very important as we have a lull in the year right now, and we have to keep one foot in the classroom and the other one in the field at all times. Okay, I'm going to talk about a couple of strategies here, but before I do that, I want to jump into HQ again. The boys have been working on our new platform here. This is your all-in-one platform. Again, I'm not going to go through everything, but there's one feature that I'm going to talk about today that ties in with strategy. Okay, I was talking to an agent last week about approaching pharmacists. How do I get in with pharmacists? These are people that deal with seniors every day. And the problem that pharmacists have is a senior might come in and say, hey, I'm here to pick up my medications. Well, your copay is $85. And the senior says, nope, not going to pick it up because I got to pay for groceries and I don't have that kind of money. And so the prescriptions are abandoned. Okay. That means the pharmacist doesn't get paid, the member doesn't get their medications, the doctor's upset because the patient's not taking their medications. So these are all these different scenarios that happen. So injecting yourself into this situation can really help you grow your book of business and help people out in the community. So connecting with pharmacists, what you're going to do is you're going to go in and you're going to say, hi, I'm Justin with Healthline Markets, and I help people save up to 95% on their medications. I do an extra help service for the community. There is no cost to this service. I'm just here to help eliminate the majority of their medications. I can help with Medicare plans and prescription drug plans, but this service that I'm offering to you, Mr. Pharmacist, is to make sure that all of your medications are picked up and you're maximizing profitability. Because if the medication doesn't get picked up, it's not just $85 that these guys get. It's hundreds, maybe even thousands of dollars per medication. And that affects their bottom line, and they are graded on how well their pharmacy goes. So I'm going to show you again, we've talked about, a tool that you can use in order to get this extra help, right? And that's benefitscheckup.org. And we've baked it right into HQ. So on the left-hand side under right resources, you're going to go down to resources, benefits checkup. You're going to click that, and it's going to pop up basically the benefits checkup website here. And on this website, very quickly, you can get the information that you need. You are now a bona fide community resource. You can go out there and help people change their lives, and then also work with the pharmacist to reduce medications. So I typed in a zip code here. I'm looking for extra help Part D here. But you can also scroll down. They've got tons of other things going on here. Veterans programs, which we were talking about earlier. But healthcare and medications is what I'm interested in. So I'm going to click that. Click next. And already just in 32808, we found 17 resources available. Whoops, went backwards. And these are the 17 programs. Obviously, Medicaid's in there. LIS is in there. Linet, which is where Humana comes in. It's administered by Humana. And if a person applies for LIS, but it's not there yet, they can fill these prescriptions immediately. So that's a cool little program. We got the MSP program and tons of other ones in here. And you can apply for these folks online right here. So it makes it very easy to centralize all of these different programs that are made available to help individuals. So specifically, you are now a community resource. We've talked about this in the past, but the approach with going in, and maybe you're out in at an event, or you want to get into a place where um, it's hard for agents to get into, right? That does happen a lot because people don't want salespeople anywhere, right? But you're no longer a salesperson. You are out there helping the community. Whether it results in a sale or not, this is a really good feel good moment for you to go out and help people that may not be able to get their medications. Also, this pharmacist is going to be loyal to you because you're helping them clean up all of these abandoned medications. You're also helping the primary care doctor or whoever prescribed the medication, whether it's a specialist or whatever, uh, make their patient compliant. Because if they're not picking up their meds, it could exacerbate some of the issues that are going on with their health. So it's just a win-win-win all the way around by doing these programs out in the community. I have done probably hundreds of these types of applications that have resulted, not every time, of course, in an enrollment, but I have clients that have followed me to the moon and back because I was able to help them apply for Medicaid, apply for LIS, apply for, getting help with their rent. I heard a story where an agent was helping fix the front porch, and there was a program that they got the front porch fixed at no cost because of some of the grant money that was available through these programs. So there's lots of different things. I recommend that you explore them. If you haven't explored this resource, I think it's a fantastic resource that you can get into and help with the community. So just going back here, let's take a look at some of the veterans programs because obviously there's like 3 or 4 trainings this week on veterans. There's 20 programs in zip code 32808. Again, you can change the zip code wherever you are in the world. Just click, you can change that zip code and you could see what's going on here. So there you go. You've got programs for the disabled veterans, the VA healthcare system, TRICARE for Life. I mean, imagine you're helping these people connect with VA services. This is a really tight-knit group of folks that if you're helping them, they will introduce you to more veterans and probably some of the other resources that are out there as well. So if you're not using this tool to promote yourself, you could be missing out on a huge opportunity. You can also promote this on social media because this is educational and customer or community focused. So you don't have to get anything approved. If you just want to put something out, hey, if you're looking for extra help, paying your bills, paying your medications, this is it, man. I mean, you could do these applications in minutes. So really excited about that. I hope people take advantage of that. So there it is. Now, with that, we have a very, very special guest on the line this morning. We have the one, the only, Vanessa Price from Optum/WellMed. And she's here to give you the good news and anything that we might need to know about the Optum WellMed brand as we're moving forward, specifically with Florida, but she can definitely connect you if you're elsewhere in the world. So good morning, Vanessa. Oh, you're muted.
Sorry, I know I just can't do 2 things at once. As I get older, I've realized I just can't do it anymore.
It's Monday, man. It's
I was
Monday.
trying to share my screen and then get unmuted.
Oh.
Impossible
Yeah,
to do.
let me make you a moderator there, so you should be able to share your screen on the bottom there. Somewhere.
Okay, I have the button available. I'm struggling to see the PowerPoint in here. I love it. Okay, hang on. Wait a second. Let me figure this out. Maybe if I pop up this, it'll go onto my screen. Let me see. Ha! Found a way. This is the right thing. What do you see?
It's there. We got it.
We got it?
We got it. We're in business.
Put this on full screen. Sorry, I'm managing like 3 different three different screens here. So I'll go here. Can you see my full screen?
It's just showing the side deck, but that's fine. We're good.
Okay, awesome. So thank you. Thank you so much for having me here, Justin. Let me know if I experience any technical difficulties as I go through the presentation, because I can't really see what I'm showing here. But
You're good. Yep.
once again, my name is Vanessa Price, and I serve as the Director of Marketing for Optum and WellMed in Florida. I've had the privilege of working with HPM for a very long time, and of course with Justin for many, many years. We started in this industry when we were 15, so that's why we're just so young still. The agent comment earlier was just a joke. Anyways, so I am here to very quickly just give you a sort of an overview about WellMed and Optum. I think many of you have worked with us, and we are so appreciative of the support, the partnership that you have shown us over the course of this year and many, many years, working together, to what Justin alluded earlier, to serve people in the communities that we serve, right? To really support them in the best way possible. And so some of the things that we do just jive very well with the services that you provide, right? I think in our world, we know that it's not just about selling an insurance policy. It is truly making sure that your client has access to the healthcare services that they need, so that you are able to retain your book of business, so that they're satisfied with the level of care and the services and the benefits that they're getting. And so that really translates into more opportunities for you, right? Because a satisfied client is sure going to make some recommendations to their friends and family. So at any rate, very quickly, and I know that we only have about 10 minutes left, and I wanted to share a little bit about what we do and what makes us special. And some of this is probably, you know a lot of this, but in a nutshell, Optum and WellMed is a value-based care organization. We focus on serving Medicare beneficiaries who are enrolled in a Medicare Advantage plan under value-based care models. And so as you all know, we support those patients through their continuum of care. So it's not just about seeing a primary care doctor, it's really coordinating the care for those individuals with their specialist, when they're in the hospital, when they need to transition into the nursing home or into a skilled nursing facility, or when they go back home post-discharge. So it's truly a very complex environment where we are helping our patients transition through that continuum of care and really giving them the tools and the resources to ensure that they can live their healthier lives. So who are our partners? Who do we do this with? Because we don't do it alone, right? Just like we partner with you to support your clients, we partner with payers in order to provide those benefits, those services. And so on the screen, you can see CarePlus, Freedom, Humana, Optimum, United Healthcare, and WellCare. Those are our payers, the payers that we work with, in which we support this particular model of care, right? This coordinated value-based care. And for us, it's super important that you know who our partners are, because as you are, helping consumers, right? There is a good chance that they'll be well aligned with one of these products, and hopefully you will consider us to serve your clients in the future. I'll move quickly because I have some of these things actually on a different slide, but I want to make sure you are aware that within our organization, we have two types of providers in our network, right? We have our employed providers, and those are the folks that actually practice within a WellMed branded or an Optum branded clinic. So again, reiterating the message that we've been trying to bring home, WellMed and Optum is one. Everything behind the scenes, our operations, our leadership, the resources that we share, it's all one. We just have two brands in the market that we support today. So we'll continue to have a WellMed brand and an Optum brand in market moving forward until further notice. So a lot of the things that we're doing, as you know, is just coming to market together as WellMed Optum. So within that organization, we have employed clinicians and we have contracted providers. And so the employed physicians partner with all of those insurances that we accept. And then our contracted providers, they may have different products, so different Medicare Advantage plans that they contract with us. Those contracted providers, just to make sure that folks know, these are independently owned physicians. Some of them are groups. One of the larger groups here in Central Florida might be PMA. They are a contracted provider. We also contract with Walmart Health. And so these are, as you can see, independently owned groups, right? They run their operations, they manage their employees, but they're contracted with us to support this value-based care environment, right, or model for specific Medicare Advantage plans. And it varies. There are contracted providers. What I can say is that probably most of our contracted providers, and we have thousands across the state of Florida, are contracted with United Healthcare. And then we have a subset of contracted providers that are contracted with Humana, some that are contracted with CarePlus, some that are contracted with Freedom Optimum, some with WellCare, and some with a combination of all of those. So we have built, and I'll show you towards the end of my presentation, a tool for you to use where you can find exactly which are the insurances that they accept with us, okay? And Justin, I don't know if there's any questions in the chat box, but please feel free to stop me if there's any, okay?
Will do. Mm-hmm.
Awesome. Our footprint, you can rest assured that we actually have providers across the state of Florida to varying degrees. Where we have employed clinics are in Orlando, Tampa. Those are our biggest networks. And then Southwest Florida, so going down to Fort Myers area, Miami, Broward, and also the Treasure Coast. From a contracted perspective, we have contracted providers in all across the state of Florida. Today, we have over 135 WellMed and Optum clinics across the state of Florida. And then, like I said, thousands of contracted providers that are part of our network. So what are some of the services that we provide today to your patients? And so one of the things that you need to know about our organization is that our focus is on healthcare. It's truly in providing the right services to people when they need it most, right? That we are preventing disease and making sure that they are getting their preventive screenings, making sure that they're really understanding how to manage their chronic conditions, and then truly be there to serve them when they need us most, when they need, urgent care, things that they need. And I'll show you how they have access to those services. So from that perspective, we kind of bucketed our wraparound, what we call our wraparound services. So all of these value-added services into 4 different categories. One of them is care support. than personal support, because we know that healthcare is just not about the body. It's really, there's a lot more that goes into really serving someone's healthcare and health needs. Their chronic condition support for those that are living with long-term conditions. And then all of the well-being support, all of the programs that are offered through the WellMed Charitable Foundation. So from a care support perspective, speaking about access to care, I think that's what we're really most proud of, is really ensure that our patients have access to care after hours, during the weekend, in whichever way is most convenient, in the clinic, via telehealth, so that they have several options to really be able to receive the care that they need. So that's something that you can rest assured that your clients are going to get the care that they need when they need it and how it's most convenient for them. From a personal support perspective, and something that we really continue to bring home with our agent partners, it's truly the social services programs that we have available at WellMed Optum, starting with our group of social workers. So we have social workers that are supporting our clinic teams and sort of the day-to-day, all of the patients and their social needs. Things like, okay, this patient is unable to afford electric. This patient is unable to get food. And so really the social workers are navigating through all of the resources, community resources, but also tapping into the health plan resources to ensure that they are getting, the most out of their Medicare Advantage. So there is also a team of social workers that is supporting what we called our most complex patients, right? And they're stratified. These are people that are homebound, maybe people that have been in and out of the hospital, folks that really need extra support in the home. And so they're really taking care of those patients and all of their social needs at home. The medical assistance program is a program that aims to support medications, and so sort of subsidizing some of the most commonly used medications whenever patients end up in the donut hole. Of course, we know that with changes in Medicare, I think the donut hole is something that it's going to go away for 2025. So, this program continues to evolve, as we all do, but today, that's how it functions. From a chronic condition support, again, these are just a series of programs that are there. Like WellMed to You is really a home care program, high touch, where these social workers, these nurse practitioners, these providers are going into patients' homes, depending on their condition and depending on the need. Palliative care, I think you're all familiar with that. Really supporting folks. And it's not necessarily end of life, but they may need to be provided with certain, I would say, care treatments to ease some of their symptoms while they're at home. And then our hospitalists and skilled nursing facilities program, where our own doctors are actually rounding these places and really making sure that patients are transitioning in the right way. And then the final piece is, of course, the well-being support. Through the Charitable Foundation, we have lots of social programs, lots of social where they can come and interact with others, fitness, where they can actually gain some muscle strength. They can actually do some, to some degree, not being physical therapy, but really helping their bodies regain strength. And so in Florida, we have 4 activity centers in Miami. We have 1 activity center in Orlando and 1 activity center in the Tampa Bay region. I'll skip through this slide, and Justin, what I'll do is I have to jump to another meeting shortly, but I'll share these slides so that you can share with the group and maybe find some information. But the one thing I want to touch on, the Wellmet Charitable Foundation, is all of the resources that we have available for caregivers. Because we know that, in many cases, healthcare is a family affair. In many cases, it's not just the patient, but their family members that are trying to support them, and it can get very complicated. So in addition to supporting the patient themselves, we do have programs and resources to support the caregivers, find solutions, find coaching, just a series of wonderful programs at no cost to them.
That's awesome. I didn't know you guys had that.
Yes, and I don't think we do enough justice to it. I think there's a lot more, and we know those of you who might be taking care of parents and children. It's just very difficult to manage all of those things, and so really giving them extra support can help. Just with the overall well-being of the family. The last thing I'll say here is, I promised I would share with you some tools and resources of where you can find more information. And so the one thing I want to make sure you know about is our Agents in FL site. This is agentsnfl.com, and Justin, I will put this in the chat box for folks to grab and copy paste into their favorite search engine. But in this tool, you can refine search by zip code, and you will find all of the doctors in our network, contracted and employed. And once you click on their profiles, you will see all of the insurances that particular provider accepts. Should you ever have any questions, please reach out. We have a team here, of course, myself in Orlando specifically, Yanni and Hillary, but we have teammates across the state of Florida that are here to support you if you have any questions. But certainly reach out to me and I can put you in the right direction. In addition to that website has something that we call the client onboarding site. And that's where you can enter your client's information, and we will take care of scheduling your client's first patient appointment. There is a disclaimer in there that you have to read to your client to make sure that you're able to share that information with us. But the beauty of this program is that, one, it takes away the hassle of you having to schedule that first patient appointment for your clients. But then also, most importantly, it allows us to know that that is your client. It keeps your name attached to that particular individual in our customer relationship management tool powered through Salesforce. And so that allows us to circle back with you, to reach out to you if we have any challenges connecting, if we have any concerns for that particular client. So again, a great tool that you can leverage, any time of the year and at any time, right? Rather than having to call the clinic or having to call one of our team members, you can quickly enter that through our website and we'll take care of you and your client. And so there's a lot more here that we can do for you, but in the interest of time, I'll take a pause here to see if there are any questions. I know we're over time.
No, it's okay. There's no questions in the chat, but I have a few. We were talking earlier about extra help programs and getting out in the community, and it looks like you have some folks internally that are doing that at the social worker level. Are those folks at each doctor's office, or are they centrally located?
So we have them, they're remote employees, but they actually serve specific geographies. So we have South Florida and Orlando and Treasure Coast and Tampa. So there's different, I wouldn't say the same team, different geographies. So no, the short answer is they're not in the clinics.
Okay. Who do they work with in the clinics? Is it the office manager or the case manager?
The care managers are providing they're working closely with the care managers and clinicians, really.
Got it. Yeah, just trying to connect the dots to see, how we
Yes,
can help on that side. And
absolutely.
then last question for me, I saw, home visits. There's not a lot of groups that are doing any type of home visits, whether it's the doctor or the nurses or whoever, but is that a service that's available to all the patients at WellMed Optum, or is there limitations, or can you talk a little bit more about that?
Sure, great question. So it is a service that is provided and it's really referred to by the primary care doctor. So if there is a need for someone to be seen at home, if there is someone that maybe cannot make it, like I said, maybe transition from a hospital stay and it's just not ready to come into the clinic, then the PCP will sort of initiate a request to have the team visit the sort of that WellMed to You program to visit at home. So it's not necessarily the PCP in the clinic. Um, Very seldomly that is the case, but it'll be one of our team members that is fully
Mhm.
aligned with the care plan and with the PCP when that happens.
Yeah, I mean, some of these folks, it's very difficult to get them to the office. So,
Mhm.
this is a great service for those folks that just can't, or struggle to get into the doctor's office for whatever reason it might be.
Absolutely.
Um,
Absolutely.
Last thing before I let you go, you've been in this biz for a while, like I have, and I'm curious to hear from you. You see a lot of agents out there that are, growing, and what you guys are doing with your grassroots efforts as well. For everyone on this call, what would be your, number one tip right now? We're going into lock in. What should these guys be doing from your perspective?
Yeah. So we know that AAP is sort of we call it the final exam, right?
Yeah.
So I think that now is the time to really connect with the community resources, to connect with, if you're working with a clinic, right? Really, this is the time to ensure that folks at the clinic are getting FaceTime with you. They understand who you are. You're building partnerships and connections so that once AP comes and is go time, you really do have folks have a way of connecting with you. And it is much easier for somebody to recommend a client, to recommend an event if they have a relationship with you as compared to maybe somebody who they've never seen or they haven't heard from in a while.
Absolutely. So creating your network now is going to pay dividends for you in AEP. Awesome.
Absolutely. That's how we see it,
Hmm.
and again, this is why we also have some great opportunities for you. I want to put in a plug for the Agent
Yeah.
Mixer on May 9th. I
Yeah.
know that your event is May 10th, so many of you may end up not coming, but we'll see you on May 10th at your event. Thank you for inviting us.
Of course.
But the difference with the May 9 event is that our clinics from South Orlando will be there on site. The doctors, they'll have tables with information. You'll be able to learn from them, what they provide in each of the clinics and build that network, right? Build those connections early enough so that, when the time comes, everything is settled. So I encourage you to participate. It's on Pinstripes at Pinstripes. It's a brand new place.
Mm,
It's from 5 to 7, non-committal. You can come in and go connect with some folks, get a drink, get some food,
mhm.
and go home and have dinner with your family. That was our goal.
Awesome. Awesome. No, that's awesome insight. I really appreciate your time and going through the WellMed Optum brand this morning. And you are amazing, Vanessa. Thank you very much for all your
Thank
time and
you.
attention. For everyone else, I really appreciate you guys tuning in. Please make sure that you connect with Vanessa, or at least grab that link that she put in the chat. And then if you are looking for WellMed Optum opportunities, please reach out to us and we're happy to help. Support at askhpm.com. We'll get you connected. Other than that, I hope everyone has a fantastic and successful week. It's almost May, close up the month, and have a phenomenal Monday. Take care, everybody.
Thank you.